Our next speaker is Richard Riggins. He's an MD, orthopedic surgeon, graduate of Duke Medical School, did his undergraduate work there also professor of medicine at UC Davis, also was at University of Tennessee and Emory University. Then he practiced in San Luis Obispo for many, many years. And I'm looking forward to hearing what a professional person like that has to say about ObamaCare. Thank you very much for coming here, Dr. Riggins.
I'm actually a retired physician from Pismo Beach. I've been retired for about 15 years, but I've maintained my interest in what's going on. I'm supposed to talk to you today about the Patient Protection and Affordable Care Act, which most of us know as ObamaCare. ObamaCare has got to be the worst piece of legislation that the Congress has passed in recent history. Not only is a major portion of the bill unconstitutional, which we're not sure the Supreme Court will agree with us, but it is ripe for fraud and abuse. As a matter of fact, the title, Patient Protection and Affordable Care Act, is fraudulent in itself. The bill's been in action now for about 1 year. It won't be fully active until 2018, but in 1 year, they've already issued over 1,000 waivers to friends of the Obama administration, small businesses, and other organizations, including a few states, that feel they're really not going to be able to comply with this bill. I'd like in my brief time to talk about two aspects of the bill. One is what they call universal coverage, healthcare coverage, and the other is about costs. The bill itself requires, if you do not, I shouldn't call it a bill, it's actually the law, says that if you do not have health insurance through your employer or through some government program, you must buy private health care insurance that's approved by the government. It's the law. Now, unfortunately, this law does not have anything in it about the manpower that's going to be required to handle all those new people. We're talking about some 30 million people in the United States that are thought not to have adequate health care insurance. There's no provision in the bill to produce any more physicians to take care of these people. It's estimated that the medical schools will have to turn out, in addition to what they're already planning to turn out, over 100,000 new physicians or providers to take care of the increased number of recently insured people that will come about because of the bill. The other aspect of the bill, which you probably need to think about but may not agree, Tony talked to us a little bit about it, is that there are some 60 million illegal aliens in the United States today. There's no provision in this bill to take care of them or provide them health care. Maybe they don't deserve it, or maybe they don't or shouldn't have it, but nonetheless, when they get sick in this country, they're going to call upon our health care service to take care of them, and we won't and probably shouldn't turn them away. That's not covered under ObamaCare either. The second point I wanted to talk about were costs. The Obama bill is supposed to reduce costs, and it's supposed to slow down the advancement or the increase in the inflation in health care. Well, we've got some examples. Medicare, which is a government-run program, and Medicaid, which is another one. Medicare is a subsidized health care program for the elderly. Medicaid is a subsidized health care program for the medical indigent and poor. Looking at Medicare first, Medicare is thought to start running a negative or a budget deficit in 2012 or 2013. If it continues to project the projection on when it's on, in 75 years, this bill alone will generate a debt of over $30 trillion. Something is going to have to be done about Medicare. Even though people my age don't want anything done about Medicare, it still is going to have to be done, or it's going to consume eventually almost the entire federal budget. Now, Obamacare does something about Medicare. It is going to cut funding of Medicare Advantage programs, but the savings, if any, will not be used to offset some of the Medicare debt. It's going to be used to offset some of the debt in Obamacare. The second one we want to look at is Medicaid, or here in California we call it Medi-Cal. Medi-Cal is funded about 50% by the state and 50% by the federal government. Unlike the federal government, the state government cannot run a deficit. And so what they're finding out is that Medi-Cal in our state, or Medicaid, is eating up the budget, and many of the services that the states would like to provide are no longer able to fund it. One that seems to suffer considerably is the public education, and the teachers are always asking for more money. Now, Obamacare plans to use Medicaid to expand this health insurance to cover most of those 30 million people that are not now insured. And the states are saying, we can't afford Medicaid or Medi-Cal here in this state. Now, we certainly can't afford its expansion. Well, there is the state of Massachusetts. And Massachusetts, 4 years ago, under Mitt Romney, that name might be familiar to some of you people, Governor Romney instituted a health care bill that is strikingly similar to Obamacare. They've got 4 years of experience. What's happened? Well, they certainly did reduce the number of uninsured. The number of uninsured in Massachusetts was around 12%. It's now under 5%. But 75% of the newly insured people in Massachusetts pay little or no health care insurance premiums. It's all on the taxpayer's dime. What they've seen is the private insurance premiums have gone from 3.7% inflation per year to 5.8%. The state budget has gone from 16% used for health care to 34% of the budget now being used for health care. The new state governor, Governor Patrick, is introducing bills into the Massachusetts legislation to apply price controls to the medical industry in Massachusetts. Now that was tried back in the 70s and 80s, about 30 years ago, and it found that price controls did not stop the rising healthcare costs. What it did do is adversely affect the quality of medicine that was being practiced, particularly in those people that receive their health care through government programs. What of the people in Massachusetts, the average person, had health insurance? What are they experiencing? They're experiencing longer waits to see their doctor. They're having problems finding physicians. And they are having longer waits for their care. The emergency room visits have increased. So ObamaCare, which is very close to Obamacare, is a small picture of what we can expect from Obamacare over the next 4 to 5 years and even longer. Thank you very much.